this last case study, so we'll have time for questions. So she's 59. She's got sarcoidosis, which is a chronic inflammatory lung disease and cardiovascular disease, referred by her lung doctor for hormone-related symptoms. She went through natural menopause at age 49, took HRT for a few years, but stopped because of worries about risks. So now she's got severe hot flashes and sweating both daytime and nighttime. When she's at home, she puts her head in the freezer to cool off. A lot of my patients do that. Her former physician has told her that she has nursing home vagina. Now, I don't care, what you see or what's going on, but there's no woman that wants to be told she's got a nursing home vagina. And she's got low energy, reduced stamina, severe stress, cognitive changes, decreased libido, and what she calls loss of emotions since she started taking antidepressants 5 years ago. She stopped the hormones, so they gave her antidepressants. Okay, so she's on quite a few prescription drugs up here. She takes oxygen at night. Then she's had stents because she had a heart attack and they put in a stent a couple of years ago. 8 pregnancies, 6 deliveries, breastfed all 6 children. And looking at her family history, her mom had menopause at age 45. She also had diabetes and heart disease, and her mom died of a stroke last year. Dad has diabetes, sister with breast cancer, aunt with breast cancer, grandmother with breast cancer. On review systems, she's having chest pain. Her cardiologist has said, don't worry about it, your stress test is okay. She's having palpitations, dyspnea. She's got hair loss on her lower extremities and pubis. And she's got pain, of course, with sexual intercourse. On her social history, she's been in her marriage for 41 years. Currently, her 86-year-old father, who she moved in with her after her mom died, and her 25-year-old disabled son and her husband are in the household, 1 dog. She's cooking for 3 men, 3 hot meals a day. She's working full-time as a bookkeeper in a factory, also volunteering 12 hours a week, no tobacco or alcohol use. Now, I don't think any woman should be cooking 3 hot meals a day, unless that's her job and she's getting paid for it. You can teach a man to make a sandwich. Ask my husband. Okay, so on physical exam, you can see that she's on the bubble with her waist circumference at 35 inches. She definitely has changes with atrophic changes in the vulva and vaginal area, hormone-related symptoms, and high inflammation, low vitamin D. But am I stopping there? No, I need to know her hormone profile so that I can adequately treat her and assist her. And look at her estrogen. It's extremely low. Her progesterone is extremely low. The ratio is extremely low. Her testosterone is low normal. DHES is way down there. But look at her cortisol. That looks good. She's okay throughout the day on her cortisol. And you say, how is that possible? This woman is doing so many things. Well, I'll tell you in just a minute. So when we look at stress in women and strain, we measure something called job strain and home strain. And strain is emotional demands versus potential for controls. And women in the U.S. that have the highest job strain are nurses and teachers. They have high emotional demands, low potential for control. Women in the home that have the highest home strain are mothers of toddlers. And I think back to when my kids were toddlers. I know one of them, I was trying to get everybody out the door in the morning and, get to the office to see patients, and I would tie her shoes too tight. She would cry, too tight. So I would untie them, tie them again, too loose, too loose. We would go through the too tight, too loose, with the 2.5-year-olds. And I felt so incompetent. I could not wait to get to the office and take care of a patient that I knew that I could do that pretty well. Then we know that women with chronic illness are very prone to problems with their cortisol, circadian rhythms, with their stress hormone. But that can be buffered by social support. And this question, how many people can you rely on to help with your children, pets, household, or transportation needs? 0 to 1, 2 to 5, 6 or greater. If a woman answers 6 or greater, she's likely to have a normal cortisol circadian rhythm, even in the face of a high social burden. And who is she likely to get that social support from? Other women. So we do have to reveal our burdens, and we do have to ask for help, and we have to be gracious and receive help. And this is a mistake that a lot of my patients make. They try to be too tough and do too much, and people offer help, but they're not specific in asking for it and receiving it. So I would encourage that. So she answered 6 or greater. That's why her cortisol rhythm looks good. She's got a lot of support. And so this is what I'm going to give her. I'm going to give her estrogen, progesterone, and DHEA. I'm going to give her an estriol vaginal cream. The compounding pharmacist makes this. And of course she needs some supplements. And then I actually wrote this on a prescription pad: stop cooking 3 meals a day. Okay, so let's see, we're going to move forward. So she comes back, she's got significant improvement in her symptoms, lifting of fatigue, less pain, improved stamina, no pain with sex. She's doing yoga twice a week. She loves the yoga. She's cooking 2 meals a day, or sometimes just 1 evening meal per day. And she wants to stop her antidepressants. So at this visit, you can see things have gotten better as far as that waistline and her hormone-related symptom scores and the inflammation. And so her hormone levels look good. We're at goal range. So we'll start weaning her off of that antidepressant. And I not only do cinema therapy with my patients, I do bibliotherapy. I recommend books. Woman's Worth by Marianne Williamson was a book that I recommended. Anybody familiar with that one? Yeah, great, isn't it? And so in the case studies in my book, I have the movies, I have the prescriptions, I have the hormone profiles, and I have the bibliotherapy.